break there.
Perfect. Well, it is my pleasure to introduce to you both my personal integrative physician and friend and colleague, Dr. Kristy Prouse. And I want to give her the just introduction, because this lady, I always, you probably don't know this, Kristy, but I always say you are brilliant, and you are. And there's good reason, because not only does she have a BA in psychology from Western University, so think about that. We have a medical doctor with a psychology degree. This is very, very good. She also has genetics and cell biology. She's got a Bachelor of Science in that too. She is a medical doctor, an MD from Queen's University, and she's gone on to study obstetrics and gynecology, and she is actually a surgeon in obstetrics and gynecology. So fantastic credentials. And she is a fellow of the Royal Canadian College, and she has also, and this is near and dear to my heart, additional training in the anti-aging medicine and regenerative medicine from the University of South Florida. And this is so important because it means she understands hormones and nutrition and all the other things that come into play into our health. She is an associate professor at the University of Toronto. She is a medical practitioner and advisory board member for the Integrative Healthcare Practitioner Journal. For me, most importantly, and perhaps for all of you too, she is the director and the chief medical officer of the Institute of Hormonal Health. And it is located in Oakville, Ontario, Canada. But because of our ability with technology, the Institute of Hormonal Health, Kristy and her team were able to actually help people, and women in particular, but men too, remotely from really, I'd say, anywhere in the world, right? She has actually delivered 10,000 babies. That's amazing. And I love this. She has spent thousands of patient hours identifying patterns of hormonal disruption, formulating treatment approaches, and designing supplements to meet her patients' needs with considerable and reproducible success. Wow, that is actually really incredible. I love your philosophy, Kristy, to reach the greatest number of patients in need, to maintain the highest quality of care, and educating both practitioners and patients in the process. So it's truly with our honor. I have referred, and with great confidence, probably upwards of 500 women to the Institute of Hormonal Health. And the feedback that I get from each and every one is tremendous, because they feel that they have a team that is actually truly looking at their whole health. And Kristy and I have had the honor of presenting several times together, which has always been really fun and really rewarding. And mostly I'm actually really honored that you are my personal integrative physician, because I put my health, my hormones, everything in Kristy's very, very capable hands. So I'm thrilled that you have given us an hour of your time tonight, Kristy, to talk about hormonal health and all things health and wellness for women. So I'm going to turn it over to you, and thank you again for coming.
No, you're welcome. Thank you for having me, for sure. And thank you for that wonderful introduction as well, and for all the patient referrals. Yeah,
you're most welcome.
yeah, thank you. I'm just going to dive into it. There's a lot of content to cover, and we'll just make the best of the time that we've got together. And at the end, we can connect questions as long as you need. So I'm here for you. So basically, just really, it occurred to me, my original title for this was The Fallout of Burnout. I thought, well, that's kind of a bummer title, but the reality is that oftentimes, women come in to see me, and men for that matter, looking for the preventative side of things, or to optimize, and they're not really at that phase yet. So many of us are deficient in so many areas, and so we actually have to work on the healing aspect of it before we can get to the optimization and prevention stage of things. So I took off the fallout of burnout and just simply put the new way to age special event. But I think it is important that we cover the sort of the classic presentation of most of my patients. So with that in mind, I've got a series of questions that I guys want you to keep track of on your fingers or write it down or something, because you'll see why in a second. If you're forgetful, there's a reason behind that. But have you been experiencing difficulty waking up in the morning? How about an afternoon low between 3 and 4 p.m.? Do you wake up between 2 and 4 a.m.? What about continued fatigue despite having a good night's sleep? Do you use caffeine to perk you up? What about cravings for salt or salty foods? Do you ever feel lightheaded when you go from standing or from sitting to standing, or from getting out of bed? How about mild depression? Worsening PMS? For those of you that are still having periods anyway. Thoughts that are less focused, foggy, or fuzzy? How about decreased tolerance of other people? Or people getting under your skin in a way that they haven't always? What about a decreased ability to handle stress? Decreased sex drive? And what about increased time to recover from illnesses, injuries, or trauma? So with those questions, if you answered 3 or more positively, then not only do you have cortisol dysregulation, but an advanced case of cortisol dysregulation. And that's key, and I'll show you why. Cortisol is basically it's our stress hormone. It's meant to help us manage with our stress. The problem is that the system can easily be on overload, because we're really, getting it from all angles in this day and age, whether it be, yes, the emotional and psychological stressors, but also physical stressors to the body. So infections, inflammation, food sensitivities, environmental toxins, all of those are stressors to the body. And so when you consider it that way, we are seeing that about 80% of the North American population now has some degree of cortisol dysregulation. And it's basically the constellation of symptoms that I just showed you there. You don't have to have all of them, but even, as I say, if you had 3 or more, then you're falling into the category of an advanced cortisol dysregulation. And the reason why it's important to understand this hormone is because it is foundational. And if that bomb goes off, then nothing goes untouched. So I alluded really quickly to some of the stressors to the adrenal glands, and I think we'll slow down a little bit here. These are, yes, the emotional and psychological stressors, that goes without saying, but our body calls on cortisol in those events. And by the way, sort of emotional and psychological stressors are often additive and cumulative. Certainly if you're carrying your baggage forward, it's additive and cumulative. It doesn't mean that we can't work our way through it and start shedding some of these stressors, but at the same time, a lot of times we have hang-ups and beliefs and ideas and constructs about how we should show up in the world, and failing to recognize that sometimes, even though we've been taught that we haven't questioned it, and that it is our downfall, really. I mean, a lot of the things that we're taught in this day and age, that we should be going 100 miles an hour and we're multitasking and nose to the grindstone and perfectionist, all that sort of stuff. It serves us well in the beginning, but eventually it catches up with us, and it'll be the very same things that kill us slowly, right? So that emotional and psychological stressors are important, but it's also the physical stressors. So things like food sensitivities, inflammation in the body. It doesn't matter where the inflammation is coming from. Most common source is the gastrointestinal tract, but also any infection. Again, it won't matter what kind of infection. All of these things call on cortisol to combat it. And then there's the environmental toxins, and that includes the electromagnetic radiation we get from our computers and our cell phones. It's the pesticides on our foods and in our drinking water. All of those are draining a system. So you can imagine that if cortisol is meant to help us manage with our stress, when the system's on overload, we don't cope as well as we're used to coping. So what are the consequences of cortisol being thrown off? Well, it really, when cortisol is dysregulated, it touches on pretty much every other system and presents with a whole range of symptoms. So for example, cortisol impacts the gastrointestinal tract. It will cause maldigestion, malabsorption. It creates a leaky gut. And via a leaky gut, we develop food sensitivities. Cortisol and thyroid absolutely go hand in hand. If you've got a cortisol issue, there's a really good chance you're going to have a functional hypothyroidism. If you have hypothyroidism, really good chance you've got an underlying cortisol dysregulation. And in fact, symptomatically, the two of those conditions, hypothyroidism and cortisol dysregulation, sound very similar. And so that's why testing is important to distinguish between those two issues and which may be contributing more to somebody's profile. Neurotransmitters. So brain neurotransmitters, the hormones that keep us happy, keep us mellow, keep our impulses in check, keep us asleep at night. Those get thrown off because we deplete them through stress, but we also have a tough time absorbing them from the gut because of the impact that cortisol has on the gastrointestinal tract and maldigestion, malabsorption. So it's kind of a double whammy when it comes to the brain neurotransmitters. And then it also impacts on estrogen, progesterone, and testosterone. So whether it's young women that are experiencing endometriosis or fibroids, infertility, a lot of that, the issue can start with the cortisol that causes an imbalance between estrogen and progesterone. Or if you're transitioning through perimenopause, cortisol will actually widen the gap between your hormones and exaggerate the symptoms of transitioning. And it's the same thing with menopause. Cortisol actually drops our postmenopausal hormones even more than they need to, and can therefore aggravate menopausal symptoms. So one of the best ways to transition through menopause uneventfully and gracefully is by working on the cortisol piece. And this just gives you an idea, again, of the connection between the sex hormones, thyroid, and then everything via the gut. So the food sensitivities and the brain neurotransmitters. So hormones are very interconnected, and you really have to tease them out and understand how to connect the dots. So hormone physiology for geeks. I know this looks like a very busy slide, but it really makes a ton of sense. And I'm gonna really simplify it. Cholesterol is what we make a lot of our steroid hormones from. It gets a really bad rap, but we actually need to have adequate cholesterol levels in order to make a lot of these hormones. So being on a cholesterol lowering drug can sometimes, and often does, impact on hormone production. Cholesterol is responsible for making progesterone. Now, progesterone is basically the mother hormone. And the reason why it's called the mother hormone is it makes all other hormones downstream from it. So progesterone makes aldosterone, which is the hormone that is responsible for regulating our blood pressure through salt metabolism. It makes cortisol, our stress hormone. It makes testosterone, and then testosterones are broken down into the estrogens. So there's your steroidogenic pathway in a nutshell. But what's important is if your body's spending a lot of time producing cortisol because of the stressors, right, it will do so at the expense of progesterone and therefore anything else downstream from it. So it's really critical with this cortisol being the foundation hormone that we stop that, what we call a cortisol steal effect, so that the body can start supporting its own progesterone and therefore production of all its other hormones downstream. So this is where you get into getting at the root cause and healing from the foundation up. You always, in the work that I do, you always have to keep asking the question, why? And often what it comes down to is this cortisol piece. It's a big player. So how is cortisol and thyroid connected? Again, another quick physiology, but for those of you that have hypothyroidism out there, this is kind of fun. T4 is the inactive form of thyroid hormone. This is all of your Synthroid, your Altroxin, the medications that people use to replace their hormones when they have hypothyroidism. So T4 in the body needs to be converted to T3. So T3 is the active form of thyroid hormone. And this is what makes us feel good, but it can only make us feel good if we can make it bind to its receptor. So what happens if we have a cortisol dysregulation is that T4, basically cortisol is interfering with not just the conversion of T4 to T3, but also the binding of T3 to its receptor. And the way that it does that is with cortisol dysregulation, it pushes T4 into something called reverse T3. Reverse T3 is inactive, doesn't really do anything for us, but it binds to our T3 receptors so aggressively that our own T3 that makes us feel good can't bind. And so from a thyroid perspective, you can see how important it is. You have to deal with the cortisol issue before you make any reasonable progress on the thyroid front. And in actual fact, if I'm newly diagnosing somebody with hypothyroidism, I will not touch their thyroid for at least 6 weeks of treating their cortisol first. And it's amazing the number of times that you can actually correct for a hypothyroidism, not needing to put somebody on medication just by working on that cortisol piece. It's a little different if somebody's had hypothyroidism, has been on medication for a long period of time. Unfortunately, it can be really hard, if not impossible, to back up the bus at that stage of the game. But if you're catching somebody early in evolution, yeah, you can make a huge difference and never have to introduce thyroid medication. So cortisol, it just reverses the whole process so that T3 can bind to its receptor and you feel good. The whole adrenal gut brain connection is just key. When cortisol, the stress hormone, is thrown off, it does create intestinal hyperpermeability, which is also known as leaky gut. It's just the medical term for leaky gut. And basically what that means is that the cells that are lining the gastrointestinal tract, they're meant to be tightly fixed together so that food stays within the gastrointestinal tract. But with stress, the cells start to pull apart. Food particles will sneak in between the cells, get into the general circulation. Your body will say, hey, what's with that? Why have I got food particles floating around in circulation? And your body will mount an allergic response to it, which is an IgG food sensitivity. So that becomes important because when you develop food sensitivities and you keep ingesting these foods, you're actually calling on cortisol yet again to combat that allergic reaction. So understanding what your food sensitivities are, and by the way, often we don't know what those food sensitivities are because the IgG type reaction is what we call the delayed hypersensitivity reaction. So delayed means the symptoms may not show up for 48 to 72 hours later. So try tracking the connection between having a food sensitivity, right? And it may not necessarily be the obvious type of allergic response. So it may show up as a funny rash on the back of your arm, or fatigue, or hair loss. So all of those can be reactions to food sensitivities, and those can easily be tested with blood spot testing. And then any inflammation in the body. And again, the gut is a very, very common source of inflammation. In fact, is the #1 source, but it can be anywhere in the body. Joint pain. It's a bit of a funny one because often my patients will present with joint pain, and yes, it's draining their cortisol levels, but it's the low cortisol that is resulting in the joint pain. It's a two-way street, and often when the joint pain is, if you think about it, everybody's heard of people getting cortisone injections into a joint to take away the inflammation. Well, it works beautifully. Not that I really want people doing that, and that's a whole other topic, but it's often because they don't have enough of their own cortisol floating around in circulation to combat the inflammation and even the daily wear and tear. And so the result is, these joint pains. Cortisol also, as I mentioned, impacts maldigestion, malabsorption, and then the food complex that our body has the greatest difficulty breaking down and absorbing are the proteins. And the reason why proteins are important is because the constituents, the amino acids, are the building blocks for all proteins that our body needs to function optimally. So that is muscle, so that we can burn fat. It is, the basics of some of the hormones, but also the brain hormones, the neurotransmitters specifically. And so via the cortisol causing maldigestion, malabsorption, amino acid deficiencies, you end up with people that are often anxious and depressed and irritable and overwhelmed and can't sleep at night. It's the fallout is amazing, and you can start to see the sort of constellation of the symptoms that I started off with. So everything's very interconnected. Here's that leaky gut that I was talking about, where the stress creates the leakiness, food particles get into the bloodstream, causing the food sensitivity reaction, calling on cortisol again. So how do we go about diagnosing any of these conditions? Well, first and foremost, you always take a history from a patient And if you're listening, often you will see a pattern emerge. And what we're looking at here, my patients fill in an intake form that takes them about 20 to 25 minutes to do. And it's a bunch of very targeted questions. And for me, it allows me to look at a snapshot at my patient's profile to see where we need to focus our efforts. But it's the same from the patient side of things. You know, a lot of times patients will Google their symptoms. They'll think they have hypothyroidism all day long. But in actual fact, 9 times out of 10, if not more, they've got an underlying cortisol dysregulation that is truly responsible for their symptomatology. And it can be very difficult, as I said in the beginning, to distinguish between cortisol and thyroid symptomatically, because they are so interconnected that you virtually cannot tell the difference. And as long as the conventional world isn't recognizing this cortisol dysregulation piece, they're going to miss it. And yet it is absolutely critical. And when I say that they're not recognizing, the conventional medical world will look at the extremes of disease, so Addison's and Cushing's, and that requires hospitalization. People know when they are in trouble, and as I say, they end up hospitalized in that situation. But there's this whole middle ground, and it really has become it's called the 21st century syndrome, or adrenal fatigue in naturopathic circles. But cortisol dysregulation, it's all one and the same, and it absolutely wreaks havoc. So, you know, this graph that we're looking at, again, this is just sort of a very typical pattern of symptoms that I see from my patients. In the perfect world, we wouldn't see any colors, but often people are showing up with, cortisol kind of leading the pack, and then the fallout accordingly. So it is important to take a history. It does help us decide where we need to focus our attention and where we need to put the effort into getting objective evidence as to where there's imbalances and deficiencies. And so, you know, in my practice, I do lots of, blood testing, but we also look at heavy metals, and I can do amino acid profiling, which basically means I can tell somebody's amino acid deficiencies right down to the 5 milligram increment, so that we can give those back to a body. And then the body, of course, will use those. And it's part of the principle of, you know, the body healing itself. You just need to supply it with the fuel that it's missing. Food sensitivity testing, iodine loading testing is another one that we often do. A good 70% of the world's population now is deficient in iodine, and iodine is just needed for a ton of different things, but largely for optimal thyroid functioning. Stool cultures, parasitology, very, very helpful. You know, technology is moving ahead at great speeds, and it is now very easy to map the entire gastrointestinal tract for all organisms that are in the gut, whether it be organisms that are supposed to be there but are overgrown or undergrown, or organisms that aren't supposed to be there. Urine hormone testing is certainly the staple of my practice, and it is really the best way to look at hormones. You can measure hormones in a pile of different ways. You could measure it in your hair if you wanted to, saliva, yes, blood. So there are tons of ways of looking at hormones, and then there are better ways. And quite frankly, in my mind, the best way is to look at it is in dried urine hormone. It gives a ton of information, including some of the metabolites. And I'll show you an example of a urine hormone test a little bit further along. And sometimes it doesn't require fancy testing. Sometimes it's just simply taking your temperature. And right, and if you've got low body temperature pretty consistently, then you can be pretty confident that you've got some form of hypothyroidism. And it doesn't necessarily mean that you have sort of the classic form of hypothyroidism where you need medication, that you can distinguish on blood work. But even if your blood work is absolutely beautiful, your thyroid hormones may not be doing for you what you want them to be doing. And that was that diagram that I was showing you with the T4 and the T3. That low body temperature is a reflection of that functional hypothyroidism. And it's not really your thyroid's fault. It's really the cortisol piece interfering with your thyroid function. So there's lots of ways to look at hormones. What we're looking at here is one part of what's called a Dutch test. Dutch stands for dried urine. And it basically is capturing, in this particular slide here, is looking at your cortisol and cortisone, which is the metabolite of cortisol. So if you look on the right-hand side, the patient's results are the red line. And in the perfect world, you would want to be smack in the middle between the two black lines. So you can see the waking samples on the low side, morning not too bad, crashes in the afternoon, and is back to normal at bedtime. So this patient sort of bounces around all over the place. The diagram on the left is really helpful for me in managing patients and helping to decide what sort of management is going to be appropriate for them. This is really part 2 of a Dutch test and gives a ton of information. So, in this particular example, you look at the big gray bar on the bottom right, that is all of our estrogens and our estrogen metabolism. So in this particular case, what's most obvious is that we've got these little red triangles all over the place. And what that's indicating to me is that this person not only has extraordinarily high estrogen levels, but also the breakdown products and metabolites of estrogen are also high. And so if you look at the red arrow down to the 4-hydroxyestrone, I don't know if you guys can see my cursor here. Let me see if I can do that. Yeah, at any rate, this patient here is at particular risk from a breast cancer perspective. And that's because of that red arrowed pathway. That's the form of estrogen breakdown product that binds to our DNA and sets us up for estrogen related cancers, or in men, prostate cancer for that matter. So it's really key that, when I'm working with this patient, that we make sure that we are normalizing estrogen levels. Estrogen levels can go up, for genetic reasons. Estrogen levels tend to go up as we approach menopause. Sometimes we aren't very good at clearing estrogen from the liver. And if we don't have regular bowel movements, then what has been cleared from the liver ends up being reabsorbed back into circulation and just adding to the pool again. So there's lots of reasons why women can have this estrogen dominance pattern. The other thing that I can tell about this, the green arrow is the protective pathway. And you can see in this particular case with the yellow triangle, barely anything goes down that pathway, and a ton is dumped into the other pathways that are not protected. It all sounds kind of, kind of scary, but having this information can be very helpful if it's known well in advance. And even better than that, we have natural ways, in fact, very effective natural ways of reducing these overall estrogen levels and redirecting traffic down the more protective pathway. So so this particular test can be really quite important. If you look in the top left, you see the box for progesterone. Now, estrogen and progesterone always want to be balanced. So in this case, you see estrogen is considerably higher than progesterone. So we've got an estrogen dominance here. That sets women up for everything from endometriosis to fibroids to infertility to breast cancer, cervical cancers, you name it. But it's most commonly the way that women often know something is off is that they have heavy periods, painful periods, breast tenderness, and PMS. So this is a classic picture for all of the above. Top right, we look at the androgens, and over to the left there is all of the androgen metabolites. So, we can tell what somebody's testosterone levels are and how they break it down. So, sometimes if women are presenting with hair loss or hair growth for that matter, in places they prefer not to have hair growth, it comes down to a sex hormone metabolism issue. So there's a lot of detail that can be captured. The other thing right down on the very bottom left here is methylation. There's a little dial there that says low to high. That's a nice indicator of whether somebody's basically able to detox effectively using the methylation pathway. So all that means is that what the body's ability to put a red flag in an excess hormone or a toxin, so that when it circulates through the liver goes, oh, wait a second, you're not supposed to be here, out you go. Well, some of us are really good at putting that red flag in, and some of us aren't. Sometimes it's a genetic thing, 30% of the times it's a genetic thing, but a significant more percentage is because of a stress-related phenomena that our methylation is thrown off. So we just keep coming back to that cortisol. This is just a busy slide really to show that there are normal ranges and there are optimal ranges. And I think that's really important. There's I don't know, some might think that there's, you hit a certain threshold and then you're okay. But generally speaking, the system wants to function in a certain range and does so more optimally. So for example, what's a good one? Let's see. Yeah, like vitamin C, either the normal range 23 to 114 at a lot of labs. Well, that's not really, if you're sitting at 23 or lower for that matter, yeah, that's really quite low, and systems aren't going to function optimally, including the immune system, as a good example. I routinely, daily see people with their vitamin C in scurvy ranges and their vitamin D in rickets ranges. So if you remember scurvy, right, that's the pirates and their vitamin C being so low that their gums would bleed and their teeth would fall out. So it's a big problem. And a lot of the vitamins that we're looking at here at the top, certainly the B12, the C, and the D and the magnesium, those are vitamins and minerals that are classically depleted with stress. And as I say, it's not just good enough to be in the normal range. You really want to optimize somebody's values. So what do we do about all of this? Well, basically, you know, the way that I approach things, it is holistic, which means that we are addressing mind, body, spirit. It's one thing, you know, my expertise is, you know, really dealing with the physical body. Yes, I have a background in psychology. Yes, I can identify people and where they could use some help. And I'm also very good at finding somebody that they can spend their time, you know, working through their issues. But it's important because, like, where we get well and stay well is by addressing the mind spirit aspect of healing. Does the physical body need support? Yeah, absolutely. And that really many times is the very easiest of things to do. I'm amazed at the protocols that patients are willing to do, but then you ask them to take a look in the mirror and it's a whole other ballgame. We're afraid of what we're going to see, which is interesting, if nothing else. Generally speaking, it's not as bad as we think it is. But integrative medicine basically means you want to use the people and the tools that you can to get the best outcome. I come at my job initially wearing an OB-GYN's hat, and you will never be able to take the OB-GYN out of me. It's how I think. It's how I've been taught. I had to do a lot of unlearning for sure. But at the same time, it's still the eyes and the lens that I see through. And I recognize that, and routinely part of my team are naturopathic doctors, and they have been trained in such a way that they will always see through their lens. And so, you know, we can't all be masters of all things. And so to be able to work with people that are good at what they do, and for that matter, you know, it's a bit of checks and balances too. It's nice to be working with somebody that, you know, have you thought of this? And you just get optimal results when you can rely on people that know what they're doing and work well together. So that's basically integrative. The work that we do, absolutely, you want to get at the root cause. And if you're not getting at the root cause, well, then you're just going to end up back where you started. And so this is where asking the question, well, why? And you'll get to the root of it, right? There is an approach, and there is a systematic and an orderly way of healing. And you want to do so, you want to heal one layer, because by healing one layer, you're actually helping to heal the layer above, which heals the layer above. And so by the time you get to some of the more, you can see the healing pyramid down the bottom right here, by the time you get to some of the higher levels of healing, a lot of times things have corrected on their own, and nothing more to do. And if there is something left to do, certainly less of it. And so I gave the example of that cortisol thyroid connection, where if I'm making a new diagnosis of hypothyroidism, I don't touch the thyroid until I've had a 6-week run at the adrenals. And there's a perfect example where you want to address the cortisol piece first before getting to the thyroid. Now, of course, a lot of people show up on my doorstep and they've already had the diagnosis, but I still don't do a lot of messing with the thyroid until we've worked on the cortisol piece. Individualized care. I don't know how you can't practice medicine that way, but you know, there are certainly ways of really targeting care. And unfortunately, you know, the conventional medical approach, yes, we use a lot of blood work, and yes, we use a lot of imaging, but we really fall short on the functional testing, and that's key. So just understanding that there's something more out there than is available, you know, through our conventional training, is important to know. So basically, you know, when you're healing from a natural approach, you're looking obviously to eliminate or reduce the cause of the imbalance in the first place. 9 times out of 10, it isn't really particularly fancy. You're just proving where people are deficient in their building blocks and or imbalanced in their hormones and replacing. So that's where the replacement of the substrates goes. Vitamins and minerals, amino acids, hormones, and enzymes go a long way. And of course, you know that all of these things our body already has. The question is, have they become depleted or imbalanced for various reasons? And then, the third way, I do use herbal remedies, but I would still say that the bulk of the work that I do is in replacement of the basic substrates to getting somebody feeling better. So this is just the healing pyramid. And I think, there's going to be a couple of things on this healing pyramid that is going to resonate for those of you that are familiar with isogenics. But if you look at the very bottom of the vitamins and the minerals and the antioxidants, right, you're not going anywhere fast if you don't address that layer. Epigenetics, that's the environmental influence on our genetic expression, really key, right? So, genetics, like my background is in genetics and cell biology, and in many ways, I think, wow, I'm a bit of a dinosaur with that. There's this whole new epigenetics, which I love now too, but it is. Yeah, it's the environmental influence on our genetic expression. So we can positively influence our genetic expression by looking after ourselves, and we can negatively influence our genetic expression by not looking after ourselves. So to think that our genetics are our genetics, that idea is long gone. And then next in line for healing, gastrointestinal tract. If you're going to have the greatest impact on the greatest number of symptoms, you got to go after the gastrointestinal tract. Amino acids. Right? Protein. Amino acids are the building blocks for protein. So protein is critical for healing a lot of times. And again, many of us are very depleted in it. And then you finally get to cortisol. So that hormone is the lowest on the pyramid here, and yet it is foundational and it impacts above and below. Then there's thyroid. Then we get into the sex hormones. Some people have issues with I shouldn't say some people, most of us have issues with heavy metal toxins. We just don't know it. And, our body is unbelievably smart and will sequester some of these heavy metals into our fat tissue. It's one of the reasons why we have fat, quite frankly, is to store heavy metals. And so when you detoxify somebody, from heavy metals, often the fat will follow. Heavy metals are important though, because yes, they get stored in fat, but what is often not so obvious is our brain is largely fat. So if we store these heavy metals in our brain, well, it is one of the reasons why we see, issues with Alzheimer's, Parkinson's, etc. Is the brain health piece of this. Candida is a overgrowth of yeast in the body. Really, really, really common. I would say about 60% of my patient population struggles with an overgrowth of Candida. Weight management is way up at the top. And the reason why weight management is at the top is because by working on all the foundational layers, often weight will fall off in the process. The other thing too is it's important to know from a weight management perspective, and for that matter, hair, skin, and nails, and libido are often the last things to come around when somebody is healing. And it's because the body, when it's under the gun and it's under stress, will focus its attention on the things that are critical for survival. Your brain, your heart, your kidney, your liver, and it will do so at the expense of the things that your body doesn't see as necessary for survival. Your hair, your skin, right? Your reproduction, and weight. And often when we store weight, particularly midsection weight gain, that's classically cortisol, your body's actually doing what it's supposed to do. It's hanging on to a fuel source for a rainy day. And so as much as it is something that most of us don't care to have, that midsection weight gain, we also have to honor our body and understanding that it is giving us an indication that it's on overload and it's trying to look after you. And so when you're healing and going through the healing process, your body has to feel satisfied that it has looked after the brain and the heart and the kidneys, and made sure that those are all squared away before it can start to turn its attention toward not hanging on to fat and growing hair and increasing sex drive. So this is the approach to healing. So to reinforce yet again, if I haven't done so already, treating the adrenals, which is where this cortisol is produced, it's essential. You're going nowhere fast if you don't deal with this cortisol issue. It's a foundational hormone, and I often refer to it as the leaky bucket phenomena. We're all leaky. The idea is to plug as many holes in our leaky bucket as possible. So that's the emotional and psychological stressors, infection, inflammation, food sensitivities, environmental toxins. So by plugging the holes in your leaky bucket, then when you go to fill your bucket with the physical body therapies, of course, you will fill your bucket that much faster. And your healing really depends on how empty was your bucket to begin with and how leaky do you continue to be. We can work on the physical body all day long, but if you're going back to an unhealthy marriage or job or whatever, you're going to find it hard to fill your bucket. And so that's really key. And it really comes back to, this is where healing the mind spirit aspect comes into play. It's huge, right? The physical body, though, we can, and I often do, treat with intravenous vitamin and nutrient therapy. So the reason intravenous is actually the magic. The vitamin and the nutrient therapy, yes, of course, it's important. There's a lot of vitamin C and magnesium and B12s, but the route of administration is key, because when you give something intravenously, you get to bypass the gut. And when most of our patients have issues with maldigestion, malabsorption, that is key. And by giving it IV, you can get 100% bioavailability at the cellular level. So one of the fastest ways of getting somebody back on track is just flood the body with a ton of the good stuff. And the body knows what to do with it. It's just as often being depleted. Adrenal adaptogens, so those are herbal remedies that work to balance cortisol, whether cortisol levels are too high or too low. Adaptogens bring cortisol back into the middle. Exercise is another excellent adrenal adaptogen, all for this cortisol piece. Sometimes when people have very low cortisol levels, we use adrenal glandulars or extracts, which comes from a pig source. You can use hormones like progesterone and DHEA to support the adrenals. But it really comes down to plugging the holes in your leaky bucket. So always factor in the gut when you're managing cortisol dysregulation. If you've got a mild cortisol dysregulation or adrenal fatigue, yeah, sometimes you can get away with herbal remedies and that's all you need to do. But if somebody's gut has been impacted, it often isn't enough. And this is where I often see the naturopaths fall short, is they often, and believe me, I love naturopaths. I'm a big supporter of naturopaths, but I can't help but see, because patients come and see us, where many of them have where they kind of miss the boat. And sometimes they're just not aggressive enough. And usually it is because they haven't factored in the gut. Not that they're not thinking about the gut, but when it comes to management, you have to pick ways of ensuring that patients are getting what you need them to get. So, at Institute for Hormonal Health, we use a lot of intravenous, which bypasses the gut, transdermal creams on the tongue, under the tongue, whatever we can do to avoid the gut. And if we have to use the gut, because sometimes you just have to, then it is better to use a liquid, so that you take, some of the effort, the body out of it, or you give even, you do the work of the body for it. So giving amino acids, for example, instead of the bigger layer of proteins. So you really just have to factor in what the GI tract is doing. Yeah. Oh, and to answer, I sort of alluded to injecting cortisone into joints and it working very well. And yes, it does. There's problems with doing that. I often get asked by patients, can you just give me cortisol? And the answer is no, I would prefer not to if we can. And this is known in conventional medical world as well. When you give somebody cortisol, you're basically telling that person's adrenal glands, don't worry, you don't need to function because I've got you covered. And the problem is that if you are faced with a stressful event, a motor vehicle accident, a pneumonia, a death in the family, sometimes when your body needs that extra kick of cortisol, it can't kick into high gear because the cortisol that you're replacing it with, in a capsule form has taken over. So you don't rebound. And that can actually be disastrous, particularly intraoperatively is where we see that, is where we have to give stress doses of cortisol through the IV in order to get somebody through surgery. So ideally, you don't really want to replace somebody with cortisol. You do your best to help the body to heal itself. So when it comes to lifestyle modifications, anything that is promoting relaxation. I'm a big fan of yoga, but again, I don't do it actually for the physical body aspect of it. I do it for the meditative benefits. Deep breathing. Some of my practitioners in my office, between every patient, they go into the bathroom and they just deep breathe for 30 seconds. So that can be very effective. Eating breakfast before 10 a.m. Now, this is for somebody who does have cortisol dysregulation. There's a tendency towards hypoglycemia, and although I have no issues with intermittent fasting, I think intermittent fasting is great. If you've got an advanced cortisol dysregulation, it's actually too tough on the body. So you're better off having small, frequent meals, setting early bedtimes. We get our most restorative sleep. And I mean restorative, not from the obvious restorative, but also from a hormonal perspective, restorative. Our most optimal sleep is between 10 p.m. and 12 a.m. So that's a pretty tight window. Most of us are not in bed by 10 p.m., let alone sound asleep by 10 p.m., right? So factor that one in. And that's the problem with adrenal fatigue too, is you tend to, you can be slow to get started in the morning. You have that afternoon slump. You get your, a little bit of a kick and, into the early evening and you're feeling pretty good, but then you start to crash too early to go to bed. So you push through it, you stay up, and then you're wired and you're up till 1 a.m. Right? And that's classic for adrenals. So you really have to kind of do your best to sort of take charge of that and recognize that pattern is actually indicative of cortisol being out of whack. Laughing often, right? That's an old one. I think most of us know that, but it really does. It increases the parasympathetic supply to the adrenal glands. It just is very, very calming to the body. And interestingly enough, studies even show that basically fake laughing, fake it till you make it, has the same effect. And again, we kind of all know that once you start laughing, you just often can't stop. And so there's definitely a therapeutic benefit there. So even if you're pretending to laugh, there's an advantage. Being active, of course, is important. And as I had alluded to, exercise is an excellent adrenal adaptogen, but you can't overdo it. I mean, you can overdo it, so don't overdo it. The body, every time you're exercising, you're creating inflammation in the body and you're calling on cortisol. So when you are working out, it's important that you work out to the point where you are refreshed. If you're working out and it's wiping you out, then it's too much, it's too intense, it's too frequent, it's too long, it's too something. You've got to dial it back until you've recovered. You've got to listen to your body, or it's going to backfire. It's the same with weight management. Right? You can absolutely over-exercise yourself where the body is just convinced that it needs to hang on to the weight. So there's so many things about isogenics that I like from an adrenal perspective. And I think having gone through everything that we've gone through here, it's going to be a little bit more obvious to you why isogenics really lines up with, from an adrenal perspective. The proteins, of course, are really key. And because so many things pretty much everything in our body is created from proteins. And so we need to consume proteins. Our body breaks it down into the amino acids, and then our body reassimilates those amino acids into proteins to make muscle, right? You need 2.5 kilos you need 2 kilos of muscle to burn 2.5 kilos of fat. So protein. And amino acids, again, it's just the breakdown, the smaller constituents of those proteins. It is something, to include a digestive enzyme with a protein as well, regardless of your source of protein, because sometimes with cortisol dysregulation, I shouldn't say sometimes, pretty much universally with cortisol dysregulation, our digestive enzymes are not functioning optimally. So the addition of a digestive enzyme does help break down proteins into its building blocks and does make it a little easier on the body. The Ionic Supreme, I can't say enough about that one. And really, not only is it chock full of adrenal adaptogens, so whether cortisol levels are too high or too low, it brings you back into the middle, but the fact that it's liquid, and there's the powdered version, but ultimately it's liquid, however you slice it, is really critical because you will get much, much better absorption in that form. In my patient population, generally speaking, most of the time I am recommending about 2 ounces twice a day. So it's a little bit more that was recommended on the bottle, but with an advanced adrenal fatigue, these herbs are not going to, you're not going to overdo it at 2 ounces twice a day. And that, that's just a very powerful. And if anybody's ever tried Ionic Supreme, you'll know exactly what I'm talking about, right? It brings a kick to your step, and and that's exactly what it's doing. It's just bringing your cortisol to a level where it's supposed to be, because whether your cortisol levels are too high or too low, both feel gross. Neither of them feel well. Your body wants to be in the middle. And that's the beauty of herbal remedies too. I know of no medication, like pharmaceutical grade medication, that works to balance anything, whether it's too high or too low. Medications work to support, or it works to bring down a level, but God has created all sorts of wonderful herbal remedies that will correct whether too high or too low. And so Ionic Supreme has a bunch of that, those adrenal adaptogens in it. As far as Cleanse for Life goes as well, another key piece, just making sure from a detox perspective, and it's got other gastrointestinal, like the aloe vera is very soothing to the gut. The licorice root extends the half-life of cortisol. Turmeric is important in the detoxification pathways for estrogen. And then berries, of course, are great antioxidants. So just all around, the Cleanse for Life, I've done it both ways, and I certainly like the smaller dose more regularly on a daily basis. I suppose it depends on what your objective is, and if you're doing a 30-day, you follow what it's suggested, which is the once a week. But otherwise, I don't think there's anything wrong when you're in the maintenance phase of having the Cleanse for Life on a daily basis. The IsoComfort, which is magnesium oxide, is probably the only criticism I have of Isagenix. It's not a huge criticism. And I'm not sure, I'd be interested in speaking to whoever decided to use the oxide version of it, because I'm sure there's a rationale behind it. But with my patient population, the body tends to tolerate, and when I say the body, I mean the bowels. The bowels tend to tolerate magnesium glycinate and magnesium bisglycinate better. And they also cross the blood-brain barrier a little better than the oxide version does. And so therefore you get a more somnolent, chilling effect. But it doesn't mean that there's anything wrong with magnesium oxide. It's not. I'm not suggesting that this is not a good product. To the contrary, we need to keep bowels moving. We do need magnesium, and IsoComfort is certainly one way of doing that. And it's got other stuff in there too that you wouldn't get just a straightforward magnesium product. The Natural Accelerator, again, awesome. We've got EGCG is the extract from green tea, cinnamon, right? Chromium to regulate blood sugars, D-ribose, another one that's great for the adrenals. So, you can just see the overall picture of Isagenix. And one of the reasons why it works as well as it works is because there's a focus on the cortisol piece and the protein piece. Those are huge. So that's often, with my patient population, Isagenix, it works beautifully, and I do use it for a fair number of people. And there are some people who need more than that, but this is a great place to start. And I'm telling you, if you don't gain the traction that you're looking for from Isagenix, or at least not, in its entirety, then it is really just an indication of how in trouble your adrenals are, and perhaps seeking an integrative practitioner at that point in time. But certainly starting with Isagenix is for sure a great place to start, and it will take people a long way without needing, the official diagnosis and whatnot. The Collagen Elixir, I have not tried it yet, but I am very excited about that because marine collagens are known to be outstanding. And I've used another marine collagen that I'm currently use, so I'm looking forward to trying the Isagenix Collagen Elixir for sure. And again, the fact that it is a liquid is also a benefit. Collagen too, it's not just a hair, skin, and nail things, it's actually vaginal health too. And I'm going to touch on that in a second. It's all part and parcel. Just a really quick highlight, important to know that there's a bunch of ways of treating thyroid, not just with Synthroid. There's just several different approaches that really requires a practitioner to support you in that front. Treatment of sex hormones. I only prescribe bioidentical hormones, which basically means that we measure, the imbalances and the deficiencies in your hormones and replace with hormones that match what your body has proven to be missing. And the idea is to reach a physiologic range and to achieve balance and to measure so that you can see some of the behind the scenes metabolites of these hormones to ensure that you're not putting somebody in a way. Just if you remember those pathways that I was showing you, it's important to understand how these hormones are broken down so that you can manage hormones adequately. And then on to urogenital health. It's a big part of it. This is a hormonal condition. So everything from a weak pelvic floor. So Kegels are important. I've got other technology in my office that works amazing. If anybody's got a leaky bladder, you might want to look up Emsella, EMSELLA, Emsella. Big giant magnet that creates not only the perfect Kegel, but a super maximal Kegel and the equivalent of 11,800 in a 30-minute session. So you can imagine how strong your pelvic floor is after 6 of those sessions. There's all sorts of really cool technology, light therapy, heat therapy, sonic therapy. There's CO2 fractional laser therapy. These last 2 categories are used to improve vaginal dryness, painful intercourse, urinary urgency, frequency, being up at night with a bladder, to empty your bladder frequently. There's that Emsella to work on the pelvic floor. There's something called microcurrent point stimulation that can be used for pelvic pain. So there's really all sorts of technology that if you do your research, you can find what you're looking for. For me and my practice is really all about best of the best. And often though, we have to come at a problem from all angles. You can't just try, one thing. You can't piecemeal it. You don't make the progress you're looking for if you make any assumptions on what the cause of the problem is. You got to get at the root cause. It is about working towards optimization of all results. If you're coming in just looking for weight management, you're going to miss the rest of the iceberg. You want to maximize the duration of all of the benefits, right? That's where you get better and you stay better. And then, of course, to provide the highest quality of care. So that's it in a nutshell. And I did okay.
You did more than okay, more than okay. Oh my gosh. I think, do we all feel like you've had like OB-GYN, women's health, hormones, health 101, 201, 301, and maybe 501. You've given us so much good information. I just love learning from you. Yes, thank you, Lori. Fabulous. Really, really great. So we are at the top of the hour, but shall we open it up? And if there's just a couple of questions that people may have for Kristy, you can, speak up, unmute yourself. Mm-hmm. Anybody have a question? Or you feel like you just know it all now? Jen does.
I have a quick question, Kristy. I love the 5 or 6 products from Isagenix that you recommended. What about some of the other products that we have with adaptogens, like our Isagenesis? Do you have an opinion about any of those, or are these just sort of your 5 favorites?
I think, talking from a package and where you can get all in one, I think, that there's your answer. Isagenix has a ton of great products, always has, and it's one of the advantages of having the resources to do the study behind it. And you've got a lot of great, people that are behind the product. So you're not really going to go wrong. But those are the ones that I have the most experience with. And of course, those are the ones, of course, have been around the longest, right? And yeah, so I would say you can't go wrong. You can't go wrong with anything, but I know those ones you can't go wrong with.
Hey, wonderful. Thank you so much. It's been such incredible information. Appreciate it.
I have a question. Christy, thanks so much. That was super informative. So the Cleanse for Life, those nutrients in there, they, like even daily cleansing, do you see that it really helps remove those toxins and stuff? Can you just speak to that for a minute about that?
Yeah. I think, one of the real advantages of Isagenix is the detoxification process, and some of the heavy metals and get captured with some of the ingredients as well. But it's the overall, and I think particularly for athletes, right? When you think of the volume of air exchange that athletes have over the rest of us, they're chock full of toxins. And as I say, one of the reasons why we have fat tissue is to sequester those toxins and keep them out of circulation. When they're in circulation, that's where they do harm. So I think the whole process of detoxifying, whether it's from fat or ensuring that the liver is working and that the bowels are moving, is critical, and critical from a weight management perspective. And so, so the daily sort of shallow cleanse, I guess, is what you could call it. We're accumulating toxins all the time. And so if you do a slow and steady way, and just staying on top of it, then you can't go wrong. And when you're throwing antioxidants in there into the mix as well, that works on an entirely other angle, and that speaks to the epigenetics angle as well. So yeah, does that answer your question?
Yeah, absolutely. So nutrition matters.
Yeah, it does. It really does. I think, sometimes the unfortunate thing is, honestly, I wish that we could get all that we needed from nutrition alone, but the reality is that our food has become so nutrient deplete. And then sometimes many of us we ourselves have become so deplete in our nutrients that we can't get it just from our food alone. So I think, in this day and age, supplementation is kind of a must in some areas. And particularly, when you measure and you see the objective evidence that your levels are, that you're at scurvy levels or rickets levels, or, you name it, you'd be surprised at what, we're talking about North America here. There shouldn't be any good reason for us to be as malnourished as we are. But we are. Yeah. Severely.
We are. And I, Christy, I've certainly spoken about this in our group and to, probably thousands of women, but I say Christy measured my magnesium levels, which were quite low. And the way I put it, you'll laugh, Christy, I go, if my levels are low, I can assure you yours are. And so I preach magnesium glycinate, to virtually anyone who will let me talk to them about it, because it makes such a difference. And it really is. We're so deficient in it. But if you can almost assume we're deficient in magnesium, would you say? I think a lot of the other ones we have to test for, but they say 75% of us are deficient in magnesium. Would you agree with that?
I would agree with that. I think it's even higher in my patient population, but of course my patient population has self-selected themselves for seeing me, but it's huge. And again, it's not just about getting your magnesium into normal ranges. You want to get them, it's depending on the lab, but you want to be above 2, which is basically the mid-range and higher. And by being in that mid-range or higher, put it this way, when you're in the lower half of the range, people end up with sluggish bowels, they're more anxious, their sleep is disrupted. Don't take, and that's the other thing too. You don't want to measure serum magnesium. The body's way too smart. It knows that it must keep its magnesium levels within the blood optimal, because it's required for heart function. But if you look at the storage version of magnesium, which is called red blood cell magnesium, that's where you really start to understand where people's levels truly are. And yeah, most of us are depleted and are certainly not in the optimal range. That's for sure.
Yeah. Well, Christy, thank you. I thank you on behalf of us. You should have a quick look in the chat. Everybody is saying thank you. And as Lisa said, she had no idea that so many factors were involved under the umbrella, and what insight you've given her into her own issues. And that sentiment, I think, is throughout the chat. So you've been a wealth of information as always, and we're really grateful that you gave us your time. And perhaps we could have you back one day, and we can expand upon more things. And really, if anybody does feel that they need and would like a consult with the Institute of Hormonal Health, I mean, that is another avenue. I love that you're so welcoming and appreciative of Isagenix, and always are, of our Isagenix family who goes there. So keep that as an option if you feel that you need it. And I'll say good night and thank you. Thanks, ladies, for showing up, and we can share the recording. I know many people that I know, and I'm sure many that you know, want the recording. So let's share this great information. It's going to help so many women.
Thank you so much, Christy.
Oh, you're
Thank
welcome.
you. Thank you. Amazing.
Good night.
Yeah.